Laser liposuction. My neck looks worse now than before the liposuction. Is there anything that can correct this for me? Hello. I had laser liposuction on my chin and neck about a year ago. My results did not turn out well at all. My neck looks worse now than before the liposuction. Is there anything that can correct this for me? Thank you for your help.
Thank you for your question. You submitted a single photo and you're stating in your question that you underwent laser lipo of the neck approximately a year ago, and you feel that your neck actually looks worse than it did before. And so you're asking about potential options to help the neck look better. Well, I can certainly share with you my approach to evaluating people like yourself who have come to my practice with exactly the same issue. I can give you a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in facial aging, rejuvenation procedures, including liposuction, laser-assisted, face and neck lifting, and I'm very much familiar with this type of scenario. So I'll begin with first helping you understand how I assess a patient who has concerns about this area, which of course you could imagine is a very popular area people want to do something about. So to begin with, first is determining, is there excess fat? 2, is there excess skin? 3, is there any laxity of the underlying muscle, which is called the platysma muscle? And also, is there any bands related to the platysma muscle? And then also, what does the neck look like in the context of the rest of the face? Is there also any facial descent? Now, there are different scenarios in which people like yourself end up in this place. And I'm seeing it a little bit more often, not just because of laser-assisted lipo, but now there are other options in the market to help also try to avoid surgical procedures. And so a lot of people are trying to treat fat as the enemy or trying to tighten skin without treating anything else. So you're certainly in good company of people who are frustrated with the results of procedures that didn't turn out the way they expected. Here's one of the major issues that I've seen for a long time, for many years, and that is the perception that fat under the skin is a bad thing. And particularly when people come who have extra skin and ask me, can you just lipo this area? Because everyone thinks that they have too much fat. So proper diagnosis is the take-home message, that even if there is a little bit of extra fat, how much will a procedure like you had make a difference? You see, the point of the laser versus lipo alone was that the hope was that A, the laser would melt some of the fat and make it a little bit easier to remove, but really, technically speaking, taking fat from under the chin is not that difficult. But the major benefit was able to be the retraction of the skin, meaning that if you have some loosening of the skin, maybe it'll retract upward. Here's the problem. You can't always really accurately predict how much someone will retract. You know that we could, if you do this laser procedure, you would get more retraction than you otherwise would, but is that significant enough? And I think that even though I know that a lot of people believe strongly in this technology, it's always about patient selection and who really can benefit from that. In a situation like yours, it's also, and not specifically to you, but it could have been a scenario where someone recommends that you undergo facelifting or face and neck lifting or just neck lifting alone. In that situation, people will often kind of brace and say, well, I'm not ready for that yet. and then the well-meaning doctor then says, okay, well, let's just do some laser lipo. Well, that being said, at this point it's clear that you're dealing with some skin laxity. And so a proper evaluation on how to manage that skin laxity will guide you as to what the next step is. Typically, it's going to be some variation of either a facelift, face and neck lift, and even a limited neck lift. Now, of course, all of these procedures have their pros and cons, and I think that you really have to kind of get a more comprehensive evaluation. I don't think that non-surgical skin tightening, whether it's radiofrequency or Nd:YAG, will be adequate. Skin with those technologies, I think, have some benefit, but really I think of it more as a qualitative improvement and not a quantitative improvement. So I think that understanding that clearly fat is not the only problem that you're dealing with, but you're dealing with skin laxity as well as skin quality. And there are definitely many options. In our practice, when I do facelift, face and neck lift, for those patients who are really concerned about the scenario of having these types of procedures, I basically reassure them that the procedure is done under local anesthesia with light sedation. So a lot of times they're intimidated by the idea and fearful about the idea of going under general anesthesia. That the procedure is done minimally traumatically. I use a lot of different techniques to try to expedite the healing process and deliver the best result possible. And you may even benefit from some tissue regenerative technology, such as the use of platelet-rich plasma to stimulate collagen in the skin, which can be used concurrently. There are more than a few ways to do this and do it in a way that is comfortable and safe. We do our procedures like this in our facilities in our offices, which are certified by the Joint Commission. So basically the same people that certify hospitals, surgery centers, where we are meeting those very stringent standards for safety and personnel and sterility, etc. So I think that ultimately you need to meet with a qualified, experienced cosmetic surgeon who can guide you, and you can figure out what kind of outcome best suits you and how to achieve that in the safest, most predictable way. So I hope that was helpful. I wish you the best of luck, and thank you for your question.